Welcome to PerimenoPower with Dr. Lauren Ward Selinger, naturopathic physician and Menopause Society certified practitioner, focusing on integrative health support for perimenopause and beyond, bringing you applicable tools and information to help you on your journey. Enjoy the ride that we will share here on PerimenoPower. Hello and welcome to the PerimenoPower podcast. I am your host, Dr. Lauren Ward Selinger. I am a naturopathic physician in Bend, Oregon, and I practice integrative medicine. I like to explain I have a foot in both worlds, the more conventional side and the more natural side. And so I utilize the tools from both of those sides to find the best plan possible for the person in front of me. And so I'm always weighing what is going to get this person feeling the best, the fastest, with the best long-term outcomes also. So sometimes my plan will include pharmaceuticals. In Oregon, I do have full prescribing rights as a primary care provider. But I also am always looking at the underlying cause of problems. What can we do to address diet, lifestyle, habits? Should we use nutritional supplements or vitamins to work therapeutically towards our goals? And then we're always looking at what are the factors that we can control? What can we not control? And we continue to work on those as we navigate this winding road of health together. So in the past few years, I have really pivoted my practice to become more of a specialist in perimenopause and menopause care. And so I use a lot of pharmaceutical agents to treat those specific things. And finding a qualified hormone menopause, perimenopause specialist is quite challenging, to be perfectly honest. I am a Menopause Society certified practitioner, which is a very conventional certification that shows that I did the work. I am up to date with the research. I have the best, care plans with the most research and scientific backing behind them. And I combine that with my 13 years of clinical experience as a naturopathic doctor as well, using herbal medicine, using diet and lifestyle, using a combination of all of these things. So that combination I feel like is rare. That's why I'm here today. I decided to start this podcast after I started the Perimenopause, which is a local Bend, Oregon monthly meetup that we've been doing for the past year. And it basically is just a bunch of women who come together, and it's clinicians in town, and it's also just regular people who want to learn more and empower themselves about how to navigate perimenopause and menopause in the best and most effective and healthiest way. It's been so fun. And we've had some incredible guest speakers. We've had so many great people come and ask amazing questions and tell us their story. And it's just been truly an honor. Why I started this was it's really hard to get this population in the door. We've been doing them on a Tuesday night once a month. And to get people there is quite challenging. A lot of these women are working. A lot of them are moms. And getting out in the evening can be quite challenging. So I decided to record this so that anybody can listen to it at any time and this resource can be at their fingertips. I am not the loudest voice out there. I'm not all over social media. I'm not blasting my opinions. This podcast is my humble opinion and my experience all wrapped up. I don't claim to know everything, but I will provide you with what I have seen work. And that's my goal, is to just make this a very accessible place for people to get current, helpful, useful information from someone who is a practicing clinician who is seeing this every day. This is what I'm treating every day. I'm helping women navigate this midlife era and embrace that change and find a solution that works for them. So it's really a passion of mine. I am navigating it. I'm in perimenopause as well. I am my number one patient. And so I've tried almost every single thing that I recommend to people. And so it's very, tried and true methods and research and science backed as much as possible too. In naturopathic medicine, if you're not familiar with it, we do have these 6 tenets that guide our medical practice. And prevention is one of them. So preventing illness before it starts by working on diet and lifestyle and mindset. And yes, even taking medications or supplements can be a piece of that. There's no one right answer for all people. And this is a very individualized decision that should be made with an educated healthcare provider. When it comes to perimenopause and menopause, I do recommend seeing a Menopause Society certified practitioner. And if they can also be a naturopathic doctor, you are going to be in the best shape. Women in perimenopause are in a really special time because there are ups and downs and there are shifts that happen really unexpectedly. They're grappling with changes in their body, their family life as kids are going through puberty or leaving the nest, or they're trying to keep the spark of their marriage of 20 to 30 years. They're working in careers and trying to stay relevant, taking care of aging family members also. It's the very, sandwich generation that we read about. There's a lot to navigate. And we need a beacon of hope in this time period. We need someone who relates with you. We need someone who offers tangible tools that can help them feel better on a day-to-day basis so they can conquer everything they need to do during the day. So that's my goal. I want to offer you those things. I want to bring in people who know more than me about specific subjects if needed, so we can learn from them. And that is why this podcast is called PerimenoPower. I want to empower you to find help, to make the changes, to feel better, to know when to rest, to know when to push through, what to eat, how to exercise, how to achieve good sleep patterns, how to enjoy your midlife sex life. I want to empower you to advocate for yourself at home, at work, and wherever you need that. Not only do I have the training and tools to help guide you, but I'm on this ride with you too. So you'll find practical advice shines here. If it's not tried and true, if it's not doable in this midlife era with all the other things you're juggling, I'm probably not going to recommend it. So that's where I might be a slight difference and shift from some of these other people you see out there on the internet and all the podcasts out there. So as a human, I am just always a moderate. I am not 100% in on anything ever. So I'm always going to be weighing, does this work? Does it make sense? Can I afford it? Do I have time for it? Right? Like I have a very realistic approach to all of that. And that is what I'm going to offer you as well. And as a clinician, right, having one foot in both of those worlds, I think that is a really important and unique piece of my practice. And I'm also still practicing. So I'm not just quoting scientific data for you. I am seeing people come in and tell me their story. I am helping them. I am seeing them come back better than they were the last time they were in. Maybe they're sleeping better. Maybe they have better energy. Maybe we got their thyroid under control, whatever it is. So I'm seeing that every day, and that is the information that I feel like is really valuable to pass on to you. So buckle up. We're going to enjoy this ride of perimenopause and PerimenoPower. I am here to empower you. So now, today, the biggest things that I wanted to talk about, because it's all over the internet right now, is estrogen. So estrogen in a normal menstruating female, it's going to have ups and downs all throughout the cycle, right? That is a normal cycle. As we head into perimenopause, one of the things that happens is that cycle isn't as cyclic. The peaks aren't peaking as high and the crashes feel a lot lower. And maybe ovulation isn't happening quite so readily as it did in our 20s. And so there may be a delay to that, or maybe you're ovulating twice in 1 month. That's actually really not uncommon. There's something called a pop cycle, which is where you ovulate twice in a month. And ironically, it makes your cycle shorter and it makes your estrogen a lot higher and potentially your progesterone lower. So people with really short cycles, if they're only having a 21-day cycle or so, then they're most likely ovulating twice and then having a pop cycle. Estrogen is really important. And the classic symptoms of estrogen deficiency are vaginal dryness, hot flashes, night sweats, and maybe joint pain. Those are kind of the top ones that people think about. In a cycling woman, even if those cycles are irregular, so somewhere in this perimenopause era, there's going to start to be some times where there's very low estrogen. And so you could have this cyclic presentation of low estrogen, meaning, oh, hey, just this 1 week of the month, my shoulder gets locked up. I have vaginal dryness. I have urinary frequency. I feel like maybe I'm getting a UTI, but I'm not. And I'm getting just super hot. And everyone else is wearing a sweater and I'm wearing a tank top. So that could be happening for a week or two in the month instead of all the time. Because then eventually this person will ovulate, possibly late, possibly early, and then their estrogen levels will go back up. But the rise of the estrogen may not be as robust as it was before. So in this particular area, this is where that balance of the natural and the conventional modalities can be really beautiful. Someone in this era may be ready for estrogen. And that might just be vaginal estrogen. Like maybe they only need it in that direct area for those couple of weeks of the month. Maybe they need an estrogen patch or an estrogen cream and they need it all the time. Or maybe they need a lower dose these 2 weeks and a higher dose these 2 weeks. This is where there is a lot of nuance in this particular area. Estrogen, it had a black box warning up until just a couple weeks ago, and that was a really awesome win for just the hormonal community, really, and the menopause practitioner community. Removing that black box warning and updating the use of estrogen and the risks that are involved with it is huge because the risks are actually pretty low. For 20 years, we've been basically told that estrogen's dangerous, it causes cancer, it causes blood clots, it causes heart disease. And that has really been kind of blown out of the water with recent data and with reanalysis of the old studies. And again, lots of nuance here, but when we talk about the risks of estrogen, most often we're talking about oral estrogen. So that's birth control pills, and that's hormone replacement that you take orally after menopause. Topical estrogen, whether that's vaginal or a systemic estrogen that you're putting on like your arm or your leg, or a patch that you're putting on your belly or your low back, topical estrogen does not carry the risks that oral estrogen does. And the reason for this is that when you put it on topically, it gets absorbed into your bloodstream and it goes all over your body and then ends up back at your liver for detoxification. So when you take it orally, you have to digest it in your stomach, it goes through your intestines, it goes through your liver, and then it goes out to the rest of your body. So what that is called is the first pass metabolism. When you take something orally, you have this first pass metabolism, it goes through the liver first. So that does end up causing some byproducts that are unfavorable and cause higher risk. So when you do the topical ones, like the cream and the patch, you skip that and you don't have the risk of these side effects. So the most recent data, to sum it up real quick, is that topical estrogen is considered safe for most women, even women who have high risk of heart disease or have a history of blood clots or have a clotting disorder. Most women are eligible for topical estrogen. So that is systemic topical estrogen. There are almost no instances that a woman can't use vaginal estrogen. Vaginal estrogen is safe for almost everybody. Older women, pregnant women, women who have battled cancer, like even people who are in active cancer treatment, a lot of them can be on vaginal estrogen specifically because it stays really local. Of course, if you are actively going through cancer treatment, that is something you'll want to check with your oncologist to be 100% clear and safe. But I really want to emphasize that estrogen is considered safe for most people with very few long-term negative effects and actually quite a long list of long-term benefits. So let's talk about that for a second. Again, all this long-term safety data, that the new stuff and the old stuff, shows that when women take estrogen and they start it soon after the menopause transition, or even during this late perimenopause phase when they're starting to have estrogen deficiency symptoms, if they started then, the risk of dementia, heart disease, and osteoporosis all go down dramatically. Those are the three biggest health risks for women as they age. So think about that, right? Taking estrogen could potentially really impact the quality of your life down the road. There is a statistic of hip fractures in women. So if someone is over 60 and they fracture their hip, their risk of death goes up 50% in that next year or two. It's really quite a fascinating statistic because that fracture just alters the quality of life so dramatically. Makes them immobile, they can't leave the house, like it changes social dynamics and requires a lot more care. Maybe they get moved into a care facility or something like that. It is the catalyst of a lot of detrimental changes for someone's aging process and their ability to live on their own and not require any assistance. So, and then cardiovascular disease, right? That is the number one problem in America as we age. It is the number one cause of mortality in this country. So if we can be using a tool that can help prevent that, I don't understand why we wouldn't, right? Even though it is a pharmaceutical. And again, this is where that I am a natural medicine doctor. I'm talking about a pharmaceutical agent that could potentially really prevent illness down the road. So that circles back to that tenet of naturopathic medicine, that prevention is really the best cure is to not even get the disease that we're talking about. So, and I don't want to sound like it's a magic bullet either, right? You still have to do the work, do the lifestyle, sleep well, eat well, exercise, don't overdo a bunch of junk food and alcohol and caffeine and nicotine and all of the things, right, that we know increase your risk of heart disease. So if you're doing all of these things that are poor for your health, but then you're also taking estrogen, right? It's not going to counteract that. So let's be realistic with that. But so what if somebody is having signs of some estrogen deficiency, but it's pretty mild and they maybe do a trial of estrogen and it doesn't work for them. They feel real crummy on it. It's the fluctuations of their cycle make it really impossible to dial in the dosage, or so this week on, week off type of pattern is not working for them, or they try it and they just get all of these symptoms of estrogen dominance, immediately upon starting it, and we can't get it under control. There are some really great herbal medicine tools that we could consider, such as maca, right? So maca is a Peruvian root that is an adaptogenic herb, meaning it really works more on the adrenal level, but it helps a lot with hormonal balance. And there are particular brands and particular formulations that have been shown to increase endogenous hormone production. So that means hormones coming from your own body. So it's working in a way of really bolstering your hormone production. So for someone in this mid to late perimenopause who can't tolerate hormones or can't take them for some other reason, that's another thing to consider. Also, let's segue over to progesterone. Progesterone has a really long list of helpful benefits as well. So mainly the fact that it helps with mood, it helps with sleep, and it balances the effects of estrogen. So when we're talking about the cycle and the ups and downs of the estrogen, that is also happening with progesterone. And one of my favorite things to give a perimenopausal woman is progesterone, because we often see this go down first. The ability to produce progesterone is not as robust. So you're supposed to get this luteal phase surge. So you ovulate and then your progesterone skyrockets and it lasts for 2 weeks until you bleed again. Well, like we talked about earlier, that cycle may not be cycling quite as well as it did before. That surge may not be happening at all. It may not be happening on time. It may only be going up to half of what it used to go up to. It may only be lasting for 6 days instead of 14. There's a lot of things that could be happening. And what I see that show up as is someone getting worsening and worsening and worsening sleep, mood, tolerance, maybe getting more fibrocystic changes in their breast tissue or heavier bleeding or more clotting or something like that. These are all signs of low progesterone. Giving someone progesterone can be very miraculous. Oral progesterone, which is just a capsule of progesterone, is usually taken at night because it is sedating and it helps people sleep. And it's a regular pharmaceutical. You can get it at a regular pharmacy, but I also compound it for people if they can't do peanut oil, because there is peanut oil in the commercial product. Or sometimes we'll be compounding it into lower doses or higher doses or some in-between dose because we've been kind of figuring it out. So compounded is available also. There is topical progesterone, but it's not my favorite. And it can be really useful in these, maybe the pre-luteal phase, or someone who's maybe extremely sensitive to pharmaceutical agents or progesterone in particular. And so sometimes we'll use it topically. But one of the big things that progesterone does is it decreases the amount of tissue that is growing in the uterus. So every month when you have a cycle, right, that tissue and blood that's coming out was the preparation for a fertilized egg to implant into, right? And when you don't get pregnant, that flushes out. estrogen really builds up that tissue and progesterone kind of squashes it a little bit. And there's this beautiful balance that happens in a normal cycling woman. In perimenopause, if there's low progesterone, what can start to happen is that tissue kind of overgrows and there's not enough progesterone balancing that. And then you get these really heavy periods, or maybe you get really clotty periods, or they're just irregular and you're getting spotting or something. These are all signs of low progesterone. Progesterone, safety data. Again, really great safety data for natural bioidentical progesterone. So that is what I use for basically everybody, is like natural prometrium progesterone. And that's a regular pharmaceutical. There are progestins, which is a different type of progesterone. It's a synthetic progesterone that, once again, does have to be metabolized by your liver, and it can make some unfavorable byproducts. So it's not my favorite. One thing about it is it does last longer in the body. So the oral micronized progesterone that I was just talking about a minute ago, that is digested and metabolized and out of your body within 8 hours. It's quite fast, which makes it perfect for taking at night, right? Like you don't want to wake up groggy because you still have so much progesterone in your body or something. Progestins don't tend to have the sedating effect, and they tend to last longer, like a full 24 hours in your body. So my experience with these is if I'm really having a hard time regulating somebody's progesterone levels and their cycles are really heavy or super wonky, it might be a tool that I would use in that circumstance. And this is the type of progestin that is in the progesterone-only birth control pill. Okay, so some people have taken those in the past and loved them, and so they may be a good candidate for that. Some people have taken them in the past and absolutely done horrible on them, and so that would be like off the table for me. And then once again, we just have to really counsel on the risks of these byproducts of metabolism with these synthetic progestins. They do potentially increase the risk of blood clots. So again, really weighing your individual risk factors and, in my opinion, choosing the best plan with the least amount of potential negative consequences. So in my opinion, in my happy world, that is a bioidentical estradiol topical and a bioidentical oral progesterone that you take at night. So that's estrogen and progesterone. Testosterone, let's talk about that. So these are the 3 most important sex hormones. Testosterone for women, it is all the rage right now. It is all over social media, it's all over the internet, and I am loving it. I am here for it. It's amazing. Women have more testosterone than they have estrogen. I think that is such an important fact to point out because we have been led to believe that estrogen is the female hormone and testosterone is the male hormone. That is not true. Men have estrogen and testosterone, and women have estrogen and testosterone. And in fact, women have more testosterone than they have estrogen. So get that, like, it's the man's hormone out of your brain. It's just not true. For women, the lab range is obviously way, way lower than it is for men. So a normal men's level, I would say, like optimal for a middle-aged man, would be like 500 to 900 or something like that. And for a woman, the lab range that most labs have is 2 to 45. 2 to 45. I find women are symptomatic if they're under 40. So depending on the presentation of the person, any potential negative side effects, etc., I will often treat people who are under a 40, even though they're at the top of the lab range. Okay, so this is my own personal comfort zone. And this is a discussion that I have with every single one of my patients if we're going to consider treating them. There is no commercially available testosterone for women. So it has to be compounded. In my opinion, it has to be compounded because we need a microdose of what a man would take. So androgel, the lowest they have is 50 milligrams per pump, okay, or per packet. Most women use about 4, 3, 5 milligrams a day. So how are you going to reliably measure out a tenth of a pump? Like, to me, that just doesn't make sense. So I like to compound it so that we know exactly what the patient is getting. I am a huge fan of compounding pharmacies, and I know that's also, quite the debate out there. If you find a good compounding pharmacy and you have reliable pharmacists that are following good manufacturing processes, there is absolutely no reason why it's any less reliable than a commercially available product. So I have been using compounding pharmacies for 15 years. I could count on one hand the amount of times there has been an error. And actually, I think probably way more often than that, there's been an error at a regular pharmacy with what they dispensed. I am a huge fan of compounding pharmacies, and I wouldn't hesitate to trust what they provide. So I use a topical compounding cream for most women. And so I have my low, medium, and high strength cream that I tend to recommend. And it really depends on how sensitive that person is, how many symptoms they have, and what their labs look like, and how aggressive really they want to be with it, right? Like how miserable are they right now? Like how quickly do we need this to go up? My optimal range for most women, again, this is going to be very specific to the actual person. I find most people feel best when they're around a 70. I personally feel best when mine's at a 90. So there is nuance here, right? Really we have to dial it into the individual. Once again, as always, like that is what functional medicine and holistic medicine and integrative medicine should be all about, is finding the perfect dose, the perfect situation, the perfect combination for the person in front of you. So going back to testosterone, symptoms of low testosterone include low libido, inability to climax, weight gain, increased fat mass deposition, and decreased payoff at the gym. Like, oh, hey, I've been doing the same strength training and I'm just not seeing the muscle development. That is a sign of potentially low testosterone. The other things are more cognitive. So having multiple tabs open at once in your brain, being able to multitask, the radio's on, you're cooking, your kids are asking you a question, you're whatever. That executive function is a really big piece of optimal testosterone. I will give you a personal anecdote. In the past 2 years, I've been on testosterone, and I started with a topical cream and got my levels to where I thought was great. I ended up doing a hormone pellet training and ended up trying pellets this year for my testosterone, which has been an absolutely awesome experience. And I will talk about that entire subject in a different podcast. And I'm not saying pellets are for everybody. I am not trying to sell them right now. I am just saying it works really well for me. And so I found by going with the pellet and basically dosing myself a little bit higher and getting myself up to that 90, I was like, oh, wow, you know what? This is really where I feel the best. Like I can multitask, I can get everything done that I want to do, and I don't feel overwhelmed and I don't feel stressed out, and I can advocate for myself better, and I just feel like myself again. I had a patient tell me that she felt like it switched from black and white to color when she went on testosterone, right? Like these are the types of life-changing stories that I hear. I've had people tell me they went back into the working field after being out of it for 20 years because they just felt like they couldn't perform the way that they wanted to. And now they're back at it. It's a real life-changing tool. Negatives of taking testosterone are on a evidence basis. There's not a lot in the literature of negatives for women. Acne is number one. And for some people, if they have really low testosterone and they start on testosterone, that's the first thing to show up. And sometimes it's just this short little burst and you got to kind of push through it while you move through these changes. And if it's not too terrible, why just walk someone through that? Some people, we got to go really, really, really low and slow. It's been low for so long. All of their hormone receptors are like, wait, what's going on? Who is this? Why are you here? And so we just have to back it up and we just have to take them to that lowest dosage and really get them incrementally higher over time. Sometimes we need to bring in some herbal therapies also to maybe make sure that they're metabolizing the testosterone properly and they're not pushing it down the wrong pathways that might lead to acne, for example, or hair loss or something like that. So acne, and then I would say hair loss, but I know that's in the literature, but I just don't see it. I don't see it happen with my patients or with myself. In fact, I think it actually really increases hair growth. And I've seen some people go back from balding patterns after they've gotten on testosterone, specifically women. Then in the literature, if you're going to read about it, clitoromegaly, okay, so enlargement of the clitoris, that is in the literature. I have yet to see it actually show up clinically. I think that the level of testosterone that people are using to get that it's just so high. It's just not a functional level. And I just don't really see it being a problem in my clinical practice with the dosages that we're using. If it did ever happen, if you stopped using the testosterone or cut back really highly on the dose, it would just go back down. It would shrink back down. So I wouldn't get super freaked out. I wouldn't let that stop me from trying it. Anyway, so that's testosterone. So we've talked about estrogen, progesterone, testosterone. Those are like the top 3 hormones that are used in hormone replacement. We talked about the best method to use them, ideally, the risks, the benefits, the potential side effects, the potential benefits. This is podcast number 1, right? Like, we are going to dive so deep into each of these subjects. And so today I really just wanted to give you that like general overview of how and why and like different options. And I am so curious, I would love your questions. I would love to have a podcast where I'm just answering, your questions about all this information I just gave you today. If you are struggling to find someone to help you, I would check out the Menopause Society Certified Practitioner, Find a Practitioner tool. I am happy to see people remotely. If you are out of state, then I cannot prescribe medications for you, but I could help you figure out what to ask for with your local provider. So I'm happy to do that, and I do that for plenty of people. I'm more of like a health coach outside of Oregon. In Oregon, I have sole prescribing rights. So if you're an Oregon resident and you're listening to this, if you live anywhere in Oregon, then I can see you and be an actual doctor for you. And if you're outside of the area, I'm still happy to check in and try to direct you or maybe help you with a good plan for labs and herbal medicine. And this is the stuff you should go ask your doctor about. So I'm happy to help with that. Together, we are going to navigate and enjoy this ride of perimenopause. Next time, I am going to have Beth Buchanan, who's a certified holistic nutritionist, and Melissa King, who is a licensed acupuncturist and Chinese medicine doctor. The 3 of us are the Perimenopause. So it's 3 of us that have really started this monthly support group in Bend, Oregon. And we've had so much fun with it. So this next episode is just going to be awesome because the 3 of us just get going and we just have so much to talk about. We could talk forever. And it's really neat to see Beth is a hormone specialist with her nutrition practice. So she brings in a lot of these daily tools, right? Like, how can we eat? Are you having proper digestion and like moving your body? And are you fueling your body in the way that really is going to allow your hormones to thrive? And then Melissa always brings this really beautiful Eastern medicine side of things, right? Like embracing where we are in life and seeing that this aging version of you who's kind of ending their fertile years has this superpower, right? Let's embrace that. Let's be the wise woman. Let's really just love ourselves for this change. And so she always has some really super fun things to say about that. So thank you for joining me. And please put your questions or comments in the chat, and I'd be happy to get to them the next time I record this. And thanks for your patience too. This is all new to me. I don't have a bunch of staff that are helping me out with this. I'm really just like grassroots trying to give you this information that I think may help impact your life in a positive way. And I'm going to do my best to provide that for you in the most professional manner that I can. So thanks for listening. Take care.